Hey everyone, today we're going to dive into a really powerful tool for making smarter, more cost-effective decisions, especially when it comes to things like healthcare. It's all about finding the most efficient way to get somewhere when you already know exactly where you're going.
All right, to get us started, let's think about a really simple choice. Imagine you're faced with two options. They do the exact same thing, they get you the exact same result. So, how do you possibly decide between them? Just keep that in the back of your mind.
You know, the source material for this explainer uses a perfect, everyday example for this. They call it the biscuit dilemma. Picture this. You're in the grocery store and you see 2 packs of biscuits. They're basically the same thing. Are you going to stand there debating the finer points? No way! You're just going to grab the one that costs less, right? Well, that simple bit of logic is the key to everything we're about to talk about.
So that biscuit principle, as it turns out, has a proper name in the world of economics: cost minimization analysis. It essentially takes that simple, intuitive choice you make in the store and turns it into a structured way to compare different options.
Okay, so what is it exactly? Well, Cost Minimization Analysis, or CMA for short, is a tool that's designed for one very specific job. It helps you compare the total costs of different options. But, and this is the big but, only when you can prove that the results, the outcomes, are going to be the same.
And really, CMA just boils down to 2 fundamental rules. First, the outcomes must be equal. That's the non-negotiable starting point. Once you've established that, and only then, can you move on to Rule 2. You just compare the costs. The cheaper option is your winner. It honestly is that straightforward.
But like any tool, right? You wouldn't use a hammer to saw a piece of wood. CMA is brilliant for some jobs and, well, completely wrong for others. So let's take a look at where it really shines in the real world, and just as important, where you shouldn't use it at all.
CMA is absolutely perfect when you're looking at true apples-to-apples comparisons. The classic example is a brand-name drug versus its generic version. They have the same active ingredient, the same effect, the outcome is identical. Or maybe it's the same drug, just made by 2 different companies. Another great example is giving the same medication in different places, like in a hospital versus at home. If the medical outcome is exactly the same, CMA is the perfect tool to tell you which setting is more cost-effective.
But on the flip side, you can't use it to compare a biscuit and a carton of milk. They're just not the same thing. In healthcare, that means you can't use CMA to compare, say, a surgery against a medication if they have different success rates or different recovery times. If the outcomes aren't equal, CMA is just the wrong tool for the job. Period. So, this brings us to the most crucial point, the biggest catch. The beautiful simplicity of CMA comes with one massive string attached. It is 100% dependent on the assumption that the outcomes are truly the same. If that assumption is wrong, the entire analysis just falls apart. Okay, so knowing that, how can you spot a good CMA study from a bad one? Well, we're going to give you a simple toolkit. Think of it as 3 critical questions you should always ask whenever someone presents you with one of these cost minimization arguments.
All right, here's your 3-step spot check. First, always ask, what's the perspective? As in, whose costs are we actually counting here? Is it the patients, the hospitals, the insurers? Second, you gotta verify the alternatives. Are they really the same? And third, examine the costs. Do they actually include everything that matters from that specific perspective? Or do they conveniently leave something out?
Let's dig into that first step, perspective, because it is so vital. An insurance company, for example, might only care about the final number on the bill they have to pay. But for you, the patient, the cost includes travel time, parking, maybe even wages you lost from taking time off work. A study that ignores all those patient costs, it's missing a huge piece of the puzzle.
So after all that, what's the bottom line? What are the key things you really need to remember about cost minimization analysis? Let's bring it all together.
First off, remember what it is. CMA is the simplest, most direct tool in the economic analysis toolbox. Its entire purpose is to do one thing and one thing only: find the least expensive option among choices that are truly equal.
And second, never forget the fine print. The power and the validity of any CMA study rests completely on that single, massive assumption of equal outcomes. And you know, that's both its greatest strength, it makes it simple, and its greatest weakness because it makes it really easy to misuse.
So, I'll leave you with this. The next time you see a study or hear someone argue that one approach is better just because it's cheaper, you now know the first, most important question to ask. And that is, are the outcomes really the same? Thanks for tuning in.